On this edition of Lifeline TV, inside the emergency room at Salinas Valley Memorial Hospital, the dedicated nurses who manage the intensity, and the physicians saving lives every day. Also, the hospital's commitment to getting patients in and out quickly. Plus, electronic health records, how barcodes, medicine order entry, and real-time scans are ensuring safety and helping patients feel better faster. This and much more on Lifeline TV. Good evening and welcome to a special edition of Lifeline TV. I'm Kate Callahan. Tonight we are taking you inside the emergency room at Salinas Valley Memorial Hospital. The ER is the front line of healthcare, and each year 44,000 people come through its doors at Salinas Valley Memorial. Inside, seconds count, teamwork is vital, and quick decision making is critical. The pace, the intensity, the urgency. It is often medicine at Mach 10. Tonight, we introduce you to the ER team.
And we're certainly capable of taking care of any trauma that would come in through the doors.
Then going to be fib when they systole. Started CPR. She got a round of epi and a round of atropine. Okay.
I am the navigator. I decide which patient goes where. I have them fax it to us. Yes.
You just go and coffee. And we have a lot of teamwork.
We're all used to the fast pace. You know, when we got to step it up, we step it up.
We are the first 30 minutes of every specialty's specialty.
Look at you feeling better.
Dr. Johnny.
We're trying to figure out if anything coming into the emergency room can hurt you or kill you in the next 2 hours, or even more subacute than that. You never know, and that's one of the reasons we chose this profession, is just, okay, ready or not, here it comes, let's go.
What's going on today? And there's algorithms. It's almost just like flying in a plane or a helicopter, and I've flown a helicopter. It's a checklist.
You just have to be able to kind of simultaneously do a lot of different things and to process multiple pieces of information in order to come to a diagnosis, make sure that everyone's being treated and that you've assessed who the sickest patients in the emergency department are.
Being able to find that sick patient and deal with that sick patient while you have many others that are in sort of very different levels of acuity, dealing with the whole spectrum, that's kind of an art. The staff here is just so good at that. When someone sick comes in, you'll see how the whole atmosphere of this place changes. Everyone gets focused in on that person.
I'm a little concerned with this one. He's doing good.
People are in their most vulnerable state when they're in the emergency department, and if you can be a kind and caring word and comforting in that situation, and also provide them with relief from pain or try to figure out what's been ailing them, then you've done a good service. What's your favorite subject?
Baseball.
Baseball, is that a subject?
I don't know.
Are they teaching that in school these days?
No.
So I'll be seeing the lady that's 84 that's dizzy this morning, and who knows why she called an ambulance.
Right.
I mean, how many people have had a dizzy episode? So, that's part of the excitement of the job, to try and get in and figure out what's different, what's going on today.
So it's really good news that it looks like her heart's functioning pretty well today.
And it's that unpredictability that anything can come those doors at any second that I think really separates emergency medicine from working in an office or a clinic. If you work in an office or clinic or anywhere else, you can always say, oh, I don't think I can take care of this here, but I don't have that option, which is both stressful and wonderful all at the same time.
Rolando Caballero was one of the 120 people that walked through the front door of the emergency room one day. He is in his mid-50s, an occasional smoker, and he says he's not the best eater. He has a wife and young daughter. He loves them both very much. He'd ignored light symptoms of heart trouble for a few months. Then one day he broke out in a cold sweat and felt pain on his left side. His wife rushed him to Salinas Valley Memorial.
I was about to die. Everybody just swarmed all over me and put me in a wheelchair and took me right to the ER room.
About 2 minutes after he walked in the front door, he had a cardiac arrhythmia where he basically died and his heart stopped beating.
Get our monitor.
I blacked out from 1 minute to another.
And I'm just sitting there being all like, what is happening? Is this true? Am I is it a nightmare or what's happening?
They battled me 3 times.
I started panicking. I started telling my mom like to get it over, and I crossed my fingers, and I pray to God to him to still be alive.
But we were very fortunate we were able to get it restarted after a minute or two.
It was a miracle that I made it.
Literally, 5 hours later, he was having dinner with his family up in the CCU, as opposed to a much worse outcome for him.
If I would have waited 5 more minutes, I wouldn't be speaking to you right now.
There was a whole bunch of people who saved his life. His wife saved his life by telling him, hey, you're having chest pain, you got to go to the hospital. Along with the nursing staff and everyone else who helps me do all those things to shock his heart and get it restarted.
Without them, I wouldn't be talking to you. They're awesome.
But that was really rewarding because he had a young daughter and I was imagining myself having to go out and tell them, this didn't work out. And fortunately it did, and everything was fine.
Well, they're very awesome. They saved my dad's life, and just, wow, they're like the best doctors.
Dr. Green's son, of course, he was awesome. Can't thank him enough.
Alice started to her feet. I'm very glad he's the best dad ever.
Salinas Valley Memorial is totally awesome. I don't think you're that good. I'm better than you.
So how do you know when to come to the emergency room? By name and design, it's meant for emergencies. Urgent care facilities have eased the strain of patient growth in Monterey County, but the bottom line advice from doctors and nurses at Salinas Valley Memorial, trust your gut, and whenever you need them, they'll be there for you.
Urgent care is very, very useful for if you have a scrape or a sprain or a cough or a cold.
If you break your arm and you probably need a cast, probably should come to the ER, because then if they need to go to the OR, we can take care of it. Chest pain should always come to the ER, shortness of breath, any unusual swelling. Anybody who has altered level of consciousness should come to the ER.
Are you having any pain? No? Are you short of breath?
I think it's always better to be safe than sorry. We have specialized training to know when further testing is warranted, and if there's any concern, I think it's always a good idea just to bring in the patient or your child for evaluation.
Yeah, so let's do it. I don't think anything's broken there from looking at it, but we'll take some pictures just to make sure.
A lot of people have an intuitive sense of what an emergency is, and they have a gut feeling, and I would say for the average Joe, go with that. If you think it's really an emergency you're having, then come to an emergency room.
Abre los pulmones. This 14-month-old came into clinic with a cough and a fever for the past couple days and increased work of breathing since this morning. He was in respiratory distress. He came in code 3 from clinic, which means the lights and sirens for the ambulance. He was retracting, meaning that his chest, when you watched it breathe, was caving in. And kids, when they're having difficulty breathing, don't always drop their oxygen levels like adults do. And their chest wall, because they're so pliable, it's very dramatic when you watch them. And he was using all of his little muscles to try to breathe and open up his lungs as best as he could. When he got here, we gave him a shot of some steroid medication to decrease the inflammation in his lungs. We gave him some breathing treatments. And he seems to be doing a lot better now.
Historically, hospitals created medical records through stacks and stacks of tedious, time-consuming forms. This is the new system, sophisticated software that provides real-time information on a patient's current treatment, medication orders, even medical history. All patient wristbands and medication are barcoded to ensure the right pills, shots, and dosages go where they're supposed to go. Here's how it all works.
She is on potassium, 10 million equivalents twice daily.
Everybody's seeing the same information at the same time. It's not on a piece of paper that is hidden on a chart or somewhere else. So anybody with access to the record on a computer is seeing everything in real time.
This harks back into the very beginning when I started working here 15 years ago. Basically, the nurse would handwrite when the patient came in, what the date was, if they were going to go to ER1 or ER2, what their complaint was, a little note about them. We would check the boxes for what kind of past medical history, what medications they were on, allergies. Everything was here on a written form. And sometimes you ran out of columns and places to put things. You had to scratch them in.
Because in the old days, you'd have to after you get the medical record, it would show up an hour later. By that, from our point of view, we're done by that point, And so this was actually real time. I found it very useful.
The emergency room physician group really, they have a lot of pride in wanting to see the patients as fast as they can, making a quick assessment, and then making certain that they get test ordered and that there's a standard protocol.
So you need to have some sort of tracking mechanism that could be tracked straight into the hospital and follow the patient all the way through the system.
We built the sets so that it'd be one-stop shopping for the doctor for the first time they go in there and want to order tests on the patient.
EMR, all your labs pop up. They have different color-coded symbols that you can see right off the bat, so you know when something's missing, when somebody needs to go to x-ray.
The concept is within 1 or 2 clicks, I can order a medication that can be titrated to its effect.
There are a lot of advantages to it in terms of that we all do what we call computer order entry, where we put all the medications in through the computer and then the nurse gives the medications. Which of the advantages of that is that it reduces error rates. I'm a doctor, so my handwriting is horrible, so it gets rid of all that, which is very, very nice.
Patients have a barcode on their identification bracelet. We take the little EMR gun, which is a little scanner. It lights up and it will actually scan, and it pops up a screen that shows us the medication that are ordered for that patient. It won't allow us to document a medication that's not ordered for the patient, so it checks to make sure that we're giving it to the right patient, the right dose, the right time.
Besides the doctors and nurses that race around day after day, there is another familiar face that spends a lot of time in the emergency room. Every week, he drops by to show his gratitude and give thanks to the men and women who helped him and his wife during their times of need. To the staff, he's affectionately called the bread guy because Bobby Anthony brings them home-baked bread. But as you'll see, he fills so much more than just their stomachs.
Yes, Bobby Anthony, I got some goodies for you.
And he comes every Sunday, brings us banana bread.
Everybody knows this gentleman in our emergency room.
It's the way I can show my appreciation.
Every weekend for the last 5 years, Bobby Anthony has made these same rounds.
How are you feeling? I'm feeling great.
You are?
The 72-year-old was born and raised in Salinas. He was just 17 years old when he married his high school sweetheart. She was 16. The Anthonys were married for 50 years before she was diagnosed with cancer.
We took care of his wife, and she was in a very critical condition, and we were able to stabilize her and then send her up to the floors.
She was diagnosed with lung cancer in November of 2005, and they always treated her real nice.
Mrs. Anthony lost her battle with cancer in 2006. Mr. Anthony is no stranger to the health care at Salinas Valley Memorial himself. Over the years, he has had several heart attacks.
I've had almost a total of 6, and I'm still here.
They have put him in the heart center, ICU, and through the ER, where doctors had to start his heart again twice.
When I had my real big heart attack, I came in at 4 o'clock in the morning, and I made it to the waiting room and I passed out.
He came in and had a massive heart attack, and he said that he was going to die, and went through the whole process through all the different levels of care, and just had great care.
The doctors and the nurses, they're all great. Just absolutely, you couldn't ask for any better.
So grateful is he for the care he and his wife have received at Salinas Valley Memorial that once a week he comes to the hospital, a small cart wheeling behind him. In the cart are 8 loaves of bread that Mr. Anthony has baked.
We know exactly who he is when he's coming. Oh, here he comes. And he brings us bread. He takes him to all the different departments that cared for him.
All right, I'm back.
2 loaves go to the ICU, 2 to the cancer ward on the 5th floor, 2 to the heart center, and 2 to the ER.
I feel like I'm doing my part, showing my appreciation. Here you go, kiddos.
Well, thank you very much.
He says he does this in gratitude for the wonderful care he and his wife received, and it keeps him busy too.
It's pretty special to know that somebody is so grateful that they're gonna, every week take out their time to bake your bread and bring it in, and so it's a pretty neat thing.
And it's so nice to see, and it's very rewarding because it's just like we made a difference in his life.
Okay, see you later.
Recently, Salinas Valley Memorial Hospital and Monterey County were honored by the American Heart Association for their STEMI system of care. STEMI is short for ST elevation myocardial infarction. It's a type of heart attack where there's an interruption of the blood supply to a part of the heart, causing cells to die. It's most commonly caused by blockage of a coronary artery. The result can be severe damage or death if not treated quickly. Time is of the essence. The 911 Heart STEMI campaign was launched at Salinas Valley Memorial in May 2010. It included the deployment of EKGs in ambulances, allowing paramedics to identify a potential heart attack in the field and begin life-saving patient care immediately. Once diagnosed with a STEMI, the goal is to get the patient from hospital door to cath lab as quickly as possible.
STEMI, ER. Another one.
Code STEMI is a really valuable collaborative house-wide response to somebody that comes in with an identified heart attack. And so, we've been successful quarter after quarter in getting patients with, under 90 minutes from the time that they arrive into our facility to the time that their vessel has basically been opened, which is the standard set by American Heart Association. And I would argue that most of the time, we're somewhere closer to the 60 minutes.
In fact, since the program's inception at Salinas Valley Memorial, the average time has shrunk to 57 minutes. By comparison, patients who don't arrive by ambulance by calling 911 average 88 minutes.
I like the STEMI program because ambulance can do EKGs in the rig now. They can call us on the EMS line. They'll let us know that they have an ST elevation, and we can have the cath lab team here, the cardiologist here, so we can get them from the door to cath lab. We can get them in 15 minutes.
And sometimes when they get into the cath lab, they identify a problem that they can't fix, in which case it becomes a surgical emergency. We're always on backup for the STEMI team. We've always got Stanford surgeons on call all the time, 24/7, 365.
Of the 83 STEMI patients tracked in Monterey County in the first 5 months of the program, 55 of them activated the STEMI system of care by calling 911 and getting to the hospital in an ambulance. That's more than 66% of STEMI patients and a significantly higher activation rate than most counties in their first year of the program.
The catchphrase is really time is muscle, and so the quicker that we can open that vessel in the cath lab is really where we need to, have the patient go as quickly as possible.
Spend just an hour inside the emergency department at Salinas Valley Memorial, and you'll see that teamwork is what powers this well-oiled machine. There's a certain choreography between the doctors and nurses as they race through the halls, ready at a moment's notice to save a life or help someone in pain get better. First and foremost, they all care about the health of each patient. Plus, they love practicing medicine. To that end, education, training, and certification matter. All doctors and nurses at Salinas Valley Memorial are held to some very lofty standards.
All of our physicians are board certified in emergency medicine. They've done a residency. A residency is 4 years. And most of the people that come here have had at least 4 to 5 years of practice after residency before they get to this place.
Here in the emergency room, we're required to have adult cardiac life support, pediatric advanced life support. A lot of us have like trauma nurse core curriculum, emergency nurse pediatric core curriculum.
Oh, I became a nurse because when I was little, I was a patient in the ER, and I had 2 types of nurses that took care of me. One was a very passionate and caring nurse, and the other nurse was really mean and really rough with me. I had burned in my leg. And I always said, I want to be a nurse so I could be the nice nurse.
We take care of just about everything. Child abuse. The nursing staff here have been educated really well on how to help those patients, that patient population that can't help themselves.
The patient socioeconomic mix is just phenomenal. That, we take care of some people who, are relatively well financially off, well educated, and we take care of a lot of people who are not so well educated, not so well off. So everything, we take care of everyone from, shootings to stabbings to the normal heart attacks and pneumonias and kind of on strokes.
I'm interested in the acute management of a lot of different disease processes. I like to do procedures. I like to take care of sick patients. I like to take care of children and, older folks and pregnant women. And really in emergency medicine, you get to take care of everything.
What makes our job hard and fun is looking at that one and they're not quite presenting like the textbook tells you. But you've seen enough things enough times that something in the back of your mind is talking to you because you saw it that way once or twice before in the last 15 years.
The hospital is great to work at because the subspecialty coverage is so great that we have pretty much everything. Neurosurgery, neurology, urology, we have everything. So it's almost like an academic medical center in that sense that you have all the subspecialists here, which is very helpful in terms of getting patients good care.
Like the population of Monterey County, Salinas Valley Memorial is growing. In 2010, the emergency room completed a major remodel. The changes did two things. Number one, update the facility to meet earthquake retrofit requirements. And second, it gave the department more breathing room, an important step as doctors and nurses saw a 30% jump in the number of patients over the last decade. The remodel is part of the plan. The other is called Split Flow, a system that has created space to get patients in and out quicker than ever.
We've made a commitment to get people in and out.
I'm a big believer in lean healthcare technology.
We really looked at the whole lean concept of doing more, but not increasing any resources, but saying how can we be more efficient.
In the mid 90s, we were seeing about 35,000 patients. Last year we saw almost 44,000 patients.
So we started seeing a lot more patients, bigger numbers, and we're seeing sicker patients. So we need the room, we need the equipment to be able to see those patients and give them the highest care that we can give them.
We implemented what we call split flow. And split flow is really trying to put the patient where they need to go, which is in front of the doctor as soon as possible. So now we'll do a limited triage on you, put you into a room, provider will see you, and know that your x-ray, if the x-ray is not ready for you, you don't get to own that bed. And so we've really changed that part. We'll put you in what we call our results waiting room. So we really created this virtual space.
And the results waiting room has been a great thing as far as opening up beds in our own department while people are just waiting for a test and can be vertical. We say if they don't need to be horizontal, we'll keep them vertical or sitting, and it frees up a bed for somebody that needs it more.
Prior to starting split flow, it took us well over an hour to get the patient into a room. Now it takes about 15 to 20 minutes.
So if you go to Fresno, if you go to LA County, they wait for 4 or 5 hours. So when we get them in, they're just excited that we brought them back so fast.
When we started in 2009, we have, give or take, about 1,000 patients that leave without being seen, which is about 2% of our patients left without being seen, which was pretty good. In 2010, that just closed, we had about 0.5%.
It's very good by national standards, local standards. It's a tribute to Darren. He's really aimed at getting that down.
And Darren's done a great job of teaching the nurses and especially triage nurses about where to put certain patients who need a certain number of treatments or interventions.
Another technical advancement in the emergency department is called the PACS system. It links physicians with specialists where they're able to view and analyze diagnostic images together in order to make accurate and quick diagnoses.
Well, PACS basically is a system that lets us pull up x-rays.
The PACS system has been revolutionary.
What you'll see is a digital array of an x-ray or CT scan or an ultrasound that you can look at, and you can look at that in real time. But also, it'll archive things. You can actually go back and look at an x-ray or CT or an ultrasound, say, from yesterday, maybe the last 7 days.
We can review the images with the radiologist while we're talking to them on the phone and actually see what they're looking at, which is very helpful because sometimes someone writes down on paper doesn't give justice to what the picture actually looks like. We can see CT scans and x-rays and stuff from other facilities before the patient gets here, so we know exactly what to expect when they get here.
We used to have film that had to be developed and you had to put it on the view box, and that had a big time delay all by itself. At this point, I am reading the x-rays before the radiologist, and I've already called the neurosurgeon with the critical bleed in the brain that I've already seen, and the radiologist is calling me afterwards saying, "Did you notice?" And I said, yeah, it's handled. It's in the OR. And that would have been impossible when I started in this job.
What do you want me to do? Give her some finally on?
There's a million examples I can go into how the PAC system can save lives. I had somebody with a gunshot wound, and I'm looking, and I'm like, I don't think that bullet penetrated his chest. And he looked normal. The textbooks would have told you if he had a gunshot wound the way that this gentleman did. We should have put in a chest tube at that point, talked to the radiologist, and he says he told me the bullet didn't penetrate. By not making intervention, I certainly put this gentleman through a lot less trouble.
Anytime somebody comes in an arrest, cardiac arrest, you don't know if you're going to get them back, but you do know the things you need to do if you're going to get them back. Mm-hmm. And when that happens, that's just fantastic. It's great.
You know, working in the emergency room is very rewarding. Because of the nature of certain emergencies, people can come in, you can actually medicate them and watch them turn around from perhaps losing their life to becoming more stable.
I had a 16-year-old who came in who was shot, and when he arrived in the emergency department, he had virtually no signs of life. He wasn't breathing, he didn't have a pulse, and he looked like he wasn't going to make it. But he had one single bullet hole, and he was 15, 16 years old, and I did everything in my power to make sure that one little bullet hole, was not going to be the end of him. And through our teamwork, we were able to resuscitate him and get him back, and he ultimately went to the operating room and was discharged to rehab.
I had a young man with testicular torsion. We were able to reduce it here in the emergency department. Had the gentleman over an ultrasound fairly quickly, able to demonstrate that there was no flow to the testicle. I then manipulated the testicle, untwisted it, and the ultrasonographer put the wand back on the testicle, was able to show perfect blood flow. That is what makes emergency medicine worth coming back. It's like hitting that golf shot that lands in the green and spins back towards the hole. Wow. Keeps you playing. We'll just get an x-ray of that while we're at it, okay?
They do the right triaging of the patients to get them into those scanners and out with the diagnosis so that we can take care of them.
Well, as a director, there's a lot of different things going on at all times, and the best thing is to have everything going smoothly as intended and without hiccups. And it's amazing with a good staff how often that happens.
Any idea how long she was down?
None.
Okay, is she uncommitted?
And a good day is smooth sailing, regardless of how busy, traumatic, or bad individual cases may or may not have been. So that's a director's perspective. It's this smooth sailing on rough seas, and we do that.
That's it for this special edition of Lifeline TV inside the emergency room at Salinas Valley Memorial Hospital. Thanks for joining us. For more on this department or any information about Salinas Valley Memorial Healthcare System, log on to svmh.com. See you again next week on Lifeline TV.